Hello mga Kirog! Welcome back to my YouTube channel. This is Rayla Quachera, and for today's video, we're going to tackle about aspirin in pregnancy. And when you heard about aspirin, what is coming to your mind, or what will be the next question? Is it safe for your pregnancy? So whenever someone will tell that, oh, I'm pregnant and I'm taking aspirin, is that safe? So with this video, we're going to tackle, or we're going to discuss the topic if it is safe for the pregnancy or not. So come on, watch my video and we will learn together what will aspirin do to your body during your pregnancy. What is aspirin? So aspirin is also known as acetylsalicylic acid. What's the use of aspirin? First, aspirin is analgesic. Analgesic means reduce pain. And then secondly, it have a component of antipyretic. Antipyretic means it reduce fever. And the third one is anticoagulant. Anticoagulant means it helps prevent blood clots. In my case, because I'm hypertensive and I am on bed rest, kaya the doctor decided to put me on aspirin. So what are the dosage of the aspirin? Low dose of aspirin is 75 to 100 milligram. So this is effective and preventing heart attack or stroke. So this is the very important question. What is the use of aspirin during the pregnancy? Low dose of aspirin has been used during pregnancy to delay the preeclampsia. So preeclampsia is a disease or a problem in which a woman is having due to high blood pressure. So it is started mostly on the second trimester, or sometimes it's also started early during the first trimester of pregnancy. So we'll tackle the preeclampsia with another video because preeclampsia is a little bit long topic. So I can explain you better what is a preeclampsia to the next video. So when it is usually started, when the aspirin is started, so usually according to, it is recommended by American College of Obstetrician and Gynecologists to start the aspirin, the low dose of aspirin in the late first trimester. When we say late first trimester, it can be started from the 12 weeks of the pregnancy. It is with a woman with a history of early onset of preeclampsia and the preterm delivery less than 34 weeks of gestation. So the next question is it safe using aspirin during pregnancy? So yes, it is safe. It is considered safe, and it is associated with a low likelihood of serious maternal or fatal complication. Study that it is safe during the pregnancy. So for those who are pregnant, that their obstetrician recommend them to use aspirin, don't be hesitant if it is only low dose, because according to this study, there is no such maternal complication or fatal complication that will happen to your baby or for you during your pregnancy. The next question is when to start the aspirin. It is recommended. The low dose of aspirin, usually they are using 81 milligram per day. It is usually recommended that it should be started 12 weeks and 28 weeks of gestation and continued daily until delivery. So usually that is the recommendation of your obstetrician or your doctor. So what are the adverse effects of taking aspirin? Mostly medication you are taking will be having this adverse effect. So there will be nausea, and you are feeling that you need to throw up. and then there will be vomiting, and there will be abdominal pain. You'll have this GI bleeding or ulceration, and that also a liver toxicity. So it is recommended that aspirin should be taken after food, so this side effect or the adverse effect will be prevented. What is the nursing teaching for the patient who is taking the aspirin? So first, instruct the patient on symptoms of the toxicity, like there is like ringing of the ear, so there is a tinnitus, and also like they will be prone to bruising, and they're also like bleeding. So how you will tell that your patient is having a GI bleeding? If the patient is passing black tarry stool or black stool, so the patient should report that to their obstetrician or to their physician. And also, do not take aspirin with alcohol because it will increase bleeding. Also, educate the patient that the aspirin has antiplatelet effect, so that is also increase bleeding. Kapag if the patient is having bruises or some GI bleeding, you will see that patient is prone to bleeding or bruising. And administer with food. This is very important. This is very important for patient who is taking the aspirin, that they should administer the aspirin, or they should take the aspirin with food to reduce the risk of GI irritation or GI bleeding. So that's all for today, and that's all for aspirin. If you have any questions that I cannot answer, you can always ask your physicians or your obstetricians why they give you the aspirin, so it will clarify any question that you have in your mind. So until next time, bye.